Great. So let me start with this sharing on okay. So good evening, everyone, and thanks for being here. And what we are doing today is learning the secret to healing any disease. Now, for a lot of people, when I put up this thing as the secret to healing any disease, so I have a lot of messages coming in, like people are a bit surprised. They're thinking, how is it that possible that you can heal any disease, and what's the secret? And that's what I really want to share with you all, that why is it that there is more of effectiveness in practicing this, or in the way in understanding this way of healing, and how we can actually start working on ailments, on relationships which are so stubbornly feeling that it is not able to, like you're not able to heal them or clear them or move with them. So that is one thing that we're going to learn over here. Yeah. And understanding the science and the root cause of the disease, and find freedom from any disease. And that's so true when we are talking about it. Right. And now, so thanks a lot, everyone, for being here. And talking about myself, I'm Dr. Rajeev Naidu. I'm a homeopathic physician, and I've been practicing for the last 25 years. And in last 15, 16 years, I've been practicing as a hypnotherapist, a past life regression therapist, been a counselor. I'm a counselor and a health psychologist. And I have my own institute called the New Life Integrative Wellness Institute. I'm an integrative wellness therapist, and I founded this works called Somatic integration, and also meditation in movement called moving stillness. And I also train people in transactional analysis. So these are the few things that I do. And how does all this come together in order to be able to heal diseases much faster, much quicker, and effectively? Like I have cases where people come with severe anxiety. Given this times, there's a lot of anxiety going around, and even with people who have been having anxiety for the last 10, 15 years. Like recently, I saw someone in the last week, and we just had to do first one session where the healing started, and in the second session, the person was wondering, should I come again or no? And the person was actually going to a counselor, a therapist for 2 years, sometime back, and 2 years every week, and this is just 2 sessions. So that is the kind of effectiveness rate I'm talking about when we are talking about healing diseases, and that's possible. And not just this, even relationships, people come in with issues like, oh, we want to separate, we want to divorce, and all that. And how is it possible that even in a session or in second session, there's a transformation happening, such that people actually drop what is actually happening and understand where they are really coming up from? And that is what we call as understanding the root cause, or the science of the problem. Once you understand the root cause of any problem, it's very much possible to heal any problem. What we generally do is that we are dabbling around the surface or on the sides of the ailment. We are not finding it easy to go into the depth of a problem, and that's what Somatic does. It just gets into the depth of the problem, and once you start knowing it, it becomes much more easier for you to start clearing up, healing any kind of disease. So that is what we are learning over here. So what I'm going to do is that I'm going to share the whole thing first, and then I will take up the questions. And I'll also show in the end a small part of what is being done, right? So for you to, like, these are some of the things that I'm doing. Founder of Accelerated Cures, Somatic Integration Therapy, moving stillness, and also training people in various other therapies. So, and you're going to have an opportunity to know about the workshop that is going to happen, that is on core somatic integration, a bit more about it, or which is happening on 31st July and 1st August from 3 o'clock to 8 o'clock. So this is an opportunity where you can actually join this workshop and learn this effective, quick healing, effective workshop. Now, secret to healing any disease. Now, introduction to learn 6 steps technique to heal any disease, initiate cellular healing in minutes, and 4 steps to reverse programming to natural immunity and health. How can you prevent incurable diseases? Now, if you notice, I put a question mark over there, because for me, how I see it, or how all the students who are learning from this therapy is, they start seeing it is that incurable is like separating it into incurable, like within curable range. Because what we see as incurable is generally that what the science or the medical science says is incurable. And why is it called incurable? Because for the medical science, the allopathic medical science, it is still about going on the outside or working on the result, or the result of a disease. The real disease is not dealt with, and that's why it seems incurable. But there is a large possibility a lot of those diseases can be healed, can be cleared up. So that is what we're going to talk about, and a scientific, rapid, and effective therapeutic modalities. And when I say scientific, yes, a lot of research has been done on this work. You can read a lot of books on this work, right? So this is what it is about. So now, very quickly asking you, what is a disease? Yeah. So what do you think is a disease? You can keep putting it on the chat. What is a disease? According to you, what is a disease? Or you can just shout out. Ill at ease, when we are not at ease. Yes. Away from natural self. Okay. Anything that disrupts the functioning of an individual. Very good. Very well written. Organs not at ease. Yeah. Organs, body. Yes. Body that is not at ease. Yes. So we know about this. Fear. Okay. Okay. So when we are talking about disease, outside ailments, so this is what we are talking about. Like, we still believe that the ailments are coming from outside, and that is what we are going to touch upon at a later point. Overthinking sometimes, that's an outcome. That's an outcome of a disease. Yeah. So yes, it can be a disease because it puts you away from ease. Yes, so that can be a disease. Now, disease is anything that puts you away from ease, like dis-ease. Yeah. Disregard, same way. Disrespect, same way. It's away from ease. Now, when we say disease, we are just looking at mostly the result, like something is like an organ that is diseased, or on the pathology, when it is seen, then we call it as a disease. But it's not necessary that it has to be seen on pathology. Then only it can be a disease. No, it's not necessary. It is just about any small shift away from the healthy state. Like someone has written disease, any harmful deviation from the normal structure or functional state. That's how it is. It's like, even if I am sitting out here and I'm not feeling comfortable with myself, that also can be a disease. But you just move and you can come back to comfort. So that's the difference. But there's a point where you're not on your own able to come back to a healthy, normal state till you start making good amount of changes. So we're talking about any kind of disease like that, where we are moving away from the healthy normal state. Yeah. And now, so even I just put it like, if you're sitting somewhere and you're not feeling comfortable, that can be also disease. But over a period of time, if it continues and it starts creating a discomfort, from the point of discomfort to actually having a structural disease like cancers also. Say anything from just a discomfort to what is seen on pathology or my naked eye or the organ change, structural change, that all is coming under the term disease. Now let's go ahead and understand the role of trauma in disease creation. What is the secret to heal any disease? These are 3 things that we're going to touch upon. So now, how long does a human being live on an average? So we know that human beings on an average go up to 60, 70, 80 and even more. Now, how does that happen? The reason is that there is something called the healing system within us. Yeah, the regeneration and the degeneration of the human system, the body system that is there. Now, if the regeneration is higher than the degeneration, you remain healthy. And if the degeneration is higher than the regeneration, just in simple terms I'm talking about, you are falling sick, right? So how do we regenerate and how do we manage that? That is very important. Now, how is it? Because there's a healing system in place and this is working, this is innate. Each one of us is having this healing system in place, right? Then we can talk about the physical thing like the WBCs and all those things, or the immunity, and we can talk about the energy that is flowing through us, and all that put together makes the healing system. Now, it is innate, it is autonomous, and it is in integrity. It is inborn. It works, it has its own intelligence. And it's in integrity, means the whole body works in integrity. At the same time, they are functioning as so if there's a smallest amount of discomfort, it works towards bringing you back to health all the time. And it doesn't need your permission. It's always working like that. Yeah, and its job is to restore order and balance to help you reclaim your natural state of health. And this works right from the time you are born. You are in your mother's womb till the time you are no more. You are dead. So this is how it is. So it is automatically working. And then, but even if it is so autonomous and all that, why is it that it is working against, or it goes into we still fall sick? That is very important to understand. Yeah. Now, some of the facts, we know this, that when a bone breaks, what happens? Even if you don't put a plaster, there will be a union of the bone happening. We know this. Yes, there might be a malunion. It may not unite in the straight line as when you put a plaster, but it does unite. If there is a injury, there's a skin injury, there's a wound, there's a cut on the muscle, then also, even with or without stitches, it will heal. We all have gone through this in childhood, if not later. Accidents, yeah, a lot of them, when they are, the body is got an extraordinary gift. We got to know this. The body knows how to heal itself. The body has an extraordinary gift. It knows exactly how to heal itself. Now, the problem with us is why the body is not able to heal itself every time and is moving into a disease state. Now, listen to this when I'm saying this. The body has an extraordinary gift. It knows how to heal itself. But the problem is that we don't know how to communicate to the body such that it heals itself. We don't know how to communicate to the body such that it heals itself. Some way we are lacking the communication. And in core somatic integration, we are learning that communication. This is very simple, so simple that people get astonished when they go through the workshop. They just get astonished that how is it possible? Because when I'm doing the work with them, right at the time, word go from in the workshop, I start showing, demonstrating on the participants how it can be healed, like calling in a participant and just doing it on Zoom also, how severe pains can go away and how other ailments can change just immediately, especially because pains we can understand, like the person is having the pain and after some time it's not there. And there are people who get the pains or they are not having the pain in 20 minutes or 15 minutes. So how is that possible? And this is the same thing that applies for many other diseases. So there was this doctor, there's this Dr. Brownstein. He's written a book, and he had a patient whose rib was removed to access his lungs because of some accident. And when this patient came to him after 25 years of the accident, when he saw his X-ray, he saw that the rib had grown on its own, though not in the same way like a normal rib, but had grown. So what had happened in this 25 years that the rib which was removed actually resurfaced or it regenerated itself or got formed. So that is what was astonishing for the doctor, and he had actually kept that X-ray in his clinic. And we know about various animals, they have a capacity to regrow their tails or body parts. So there's something that is there within all of us that it can regrow. Only thing is that we have not touched upon it, or we are not touching upon it. Okay, so now very quickly I want you to, so what we are going to do is that it's a two-way thing. One is that I am going to tell you about this, and second is I am also going to show you how and what is being done, though very little, because generally it's a 12-hour workshop and I'm just taking a 1-hour session. Yeah, so I would request all of you just to close your eyes for a moment and just observe your breath. Remember, we are not going through a whole therapy session. It's not possible. So I request people that there are many people who say, can you treat this right now? It's not possible. Yeah. Because once the therapy started, I don't know how much time it takes. So we are not going to do that, but I'm going to tell you how it is done. So just focus on your breath at your nostrils. And notice your breath going in and out. Going in and out. And now pay attention to the sensation of your breath at your nostrils, where your breath touches your nostrils. Just feel it. Yeah, just feel it inside. You don't need to touch your nostrils. Just feel it inside, like how the breath goes inside your nostrils. Is it warm? Is it cool? Is it touching the top deep inside the nostril? Or is it touching just on the external? And also notice what kind of sensation it produces in the body. Just be Just observe it, keep observing it, do not analyze it. You may have thoughts, you may have ideas coming in your head. And now, gently, yeah, feeling uncomfortable in breathing. Okay. And now you may put down over here just in case you felt something in your nostrils or in the body, whatever sensations you felt. So someone has written, Kaushik, feeling uncomfortable in breathing. Okay, great. So just keep focus on your breath and now slowly open your eyes and you may type in on the chat, what were the sensations? Cool air going in, warm air coming out. Okay, great. That is good. Was fearful during breathing. Oh, that's a good one. That's very, very important. And that's how we start healing. Cool air. Relax, relax. Yeah, the sensations. Put down the sensation, not the effects of it. What did you feel? Feel warm. Yes. Preeta, very good. Attention went to my stomach. That's a very good one, Shamla. Feeling calm. Yes. Get into, that is the effect, Dr. Anu. That's the effect. Go into what did you feel as sensation. That was, again, that also is a sensation, but still cool inhale, warm exhale, felt till the throat relaxed. Okay, great. Feeling good. Okay, okay. Couldn't feel any sensation in nose, feel like breathing was from stomach. Okay. And how do you know it was from our stomach? That is again a sensation. Unable to follow the breathing, focus on breathe in and got tensed. Okay, so getting tense was there. Yes, very good. Relax and calm. So we are able to. So many a times what happens is that we are not able to know that it's a sensation because it's like it's so much there that it becomes redundant. We don't even pay attention to it. Restless. Yes, that's a good one. I can't feel much because of water accumulation in stomach. Okay, I get that. So not feeling, you are definitely feeling something. Yeah. When you say water accumulation in the stomach, just observe what's happening in the stomach, also what's happening in the rest of the body. Felt the stomach compressing and releasing with my breath. Very good. These are all sensations. So a lot of people have put in a lot of sensations. That's very good. Yeah, and this is where we begin understanding the communication of the body as to what's happening. Understanding the communication of the body as to what is actually happening within us. Now get that at this point, we are not even paying attention the way we just did it. And that's amazing that most of us could actually connect in this fashion, right? So now let's understand what actually happens over here. So now what we are doing is moving. What we are doing over here is moving from we are moving on viewpoint of healing. We are moving our viewpoint of healing. So let me tell you, this could be surprising. Some of people may know it or may not know it. The kind of healing that we are generally following till now is the Newtonian, Isaac Newton, the Newtonian mode of healing, going from the cause to the effect. Yeah, because if there's a cause, there has to be an effect, and we keep looking for the effect of it. But when we are working with this kind of the body-centered therapy, the core somatic integration, we are moving into Einsteinian way of healing, understanding the source of what it is and looking at the whole thing from a different viewpoint altogether. And that is one of the reasons I've been able to heal relationships, help people heal their relationships and even anxieties and diseases at a rapid pace. That's because the whole understanding shifts by the time they are there and they start looking at the ailment. And once the understanding changes, the whole disease also starts moving rapidly towards health. So that's one thing that we need to learn. Yeah. So coming back to our thing. So now let's understand trauma in brief. So what is trauma? What is trauma? What is trauma? Keep typing in. Some incident that adversely affects us. Very good. Disturbing experience. Okay. Unhealed parts of us, painful experience, distress. Oh, distress. Yeah. A bad phase of life. Yeah. Yes, go on. Very good. Some event where you could not find a solution for. Emotional. Okay, that's too fast. Fast. Okay. Emotional energy which was unable to heal. A state of great shock and sadness. That's a good one. Okay, a lot of people. Emotional response to a terrible event which took place. Yes, very good. Some event where you could not find a solution, great shock, feeling of helplessness, physical injury, emotional energy which was unable to heal, disturbing experience, buried emotions. Great. So now some of them have put it very well. Now trauma is basically a point where you were not able to, like an event which produces a sense of shock, where you're feeling helpless and hopeless. You cannot see an end to it, or you cannot see how can you get out of it. So it is not just something disturbing or something happening to you. Trauma is an experience. It's not an event. It's not a sad event outside you. That could be an event, but it becomes traumatic when you feel very helpless and hopeless and you're not able to do anything about it. That is where, like a crisis situation, like you are held at a gunpoint, or some major loss like that, losing a child, or the child is so sick, or someone whom you love is so sick and you don't know how to get up. That can become a trauma. Now remember, trauma can be the way it is experienced can be different for different people. It is not necessary that it's a terrible event, so it will be traumatic for everyone. No, it's not necessary. That's something that we got to know. If it doesn't mean that just because your building is on fire, or something really went wrong, or you think some near and dear one, there's a loss of a near and dear one, and that's why it should be traumatic for all. No, Like a simple example I will give you, just in case you are walking in a dark street and you're accosted by some hooligans or someone who's a kidnapper or whatever, or shows a knife on you, and you are very scared. Now you don't know what to do, and that can be traumatic for you. But for a person who's a martial artist, who knows the martial arts very well, who knows how to fight, now for that person, it may not be traumatic. Or you are driving at night all alone and you're traveling through a midst of jungle, and suddenly there's a breakdown of your car and you just don't know what to do about it, and you're very scared because you can hear voices or you feel people, and then you get very scared and you just feel so helpless. But for a person who knows the in and out of the vehicle, it may not be traumatic. It's just, oh, how do I deal with it? So it is just a state of mind, and then the effect that it produces on you, and then it stays on you, that is traumatic. Like I've worked with people who have gone through abuses, rapes, and whatnot, and all those things, and abuses in relationship. And how do you heal them very quickly? How can you help them to get out of that traumatic experience? And remember one thing, I believe that you cannot change it by just talking to them. And many of the counseling methods, because I've had people who have been working with traumatic clients, like they are the trauma specialists, and I've had clients coming from them, and they have been with those people, with the therapist for maybe a year or two. But what is the difference is that here I support them in going back where the traumatic experience is, and that is in the body. And it cannot be just removed by talking to them or just revisiting the event. That is one of the ways, but it cannot be healed. You have to actually work at the traumatic experience. Now, when the traumatic experience is not dealt with properly, then it starts expressing itself because it gets stored in your nervous system. That experience gets stored in your nervous system, and then it expresses itself time and again, as and when it triggers off that memory or that experience, even after years together. And then that person starts reacting. Even after years together, the person starts reacting as if the situation is happening now. For example, you are growing up, and in childhood you had an authoritarian or a dictator kind of parent or parent figure, or you had gone through something very bad, maybe an abuse, a sexual abuse. Now, as you grow up, you might be 25, 30, 35, 40. And whenever you see someone who's having a loud voice or is an authoritarian, or a person who even vaguely resembles, vaguely, it doesn't have to be the look also, it just, in your mind, it goes off, boom. And suddenly you start breaking in sweat, or you start stammering, stuttering, or you get that pain, cramp, anxiety, and whatnot and what all. So that can happen as if it's happening now, but the situation currently doesn't warrant for such kind of reaction. But you say, I don't know. And that's one of the reasons many relationships are breaking down these days. Because I was working with someone even today, and when we started working, and there's a huge problem she's having with the husband and the family, and they're trying their best to help her in a way that she understands that there's no problem, we're all living happily. But for her, everything is like so wrong about them. And when I worked with her, she realized that in childhood there was so much of commotion, there was so much of fights happening all over all the time between all the members of the family. They were a joint family. And though she's 30, 35, she's 40 now, but she still reacts as if everything is wrong in the family and no one is trying to understand me. And this reaction is creating so much of problems in her family life that she's coming to a point, she says, I don't want to stay with my husband. I don't want to stay with this family. But knowing the family and knowing the way they are going about, I can see that they're trying to support. So what I'm trying to say is that even when you grow up 25, 30, 40, 50, you may go back immediately to that point and react as if the issue is happening now. For example, like in childhood, you were walking down and there was a dog that barked at you and you thought the dog is going to bite you, or maybe something happened like that, the dog bit you. Now, even at the age of 50, I have some friends who just don't ever think of getting close to a dog. Not possible. They would break into sweat, they would say no, or they run away, or they would just not visit the place. Now, just as an example, and this is what it is. Now, when you are in that experience as if though the situation is not warranting it. Now, if the situation warrants it, you're still okay. But if the situation doesn't warrant it, then you are creating or discharging the hormones, or the chemicals are being discharged. Even though there is no situation like that, the chemicals are being discharged, or because of the emotions that are running so high now, the chemicals are being discharged, but there is no way you can use up those chemicals because there's no situation. So the boss is bad, or you see that there's some issue happening in the family, but it is not like that sexual abuse that happened at that time or some other abuse that happened at that time, and you still react with that anger or helplessness or hopelessness, and the body is releasing those chemicals. Now those chemicals are not being used up, because to use up, we have two reactions. One is called the fight response and the flight response, because whenever this is happening, we are going into a fear mode. We are going into a fear mode. Yeah. But here there is no way that, since the situation is not such, you cannot run away, or you're not running away, nor you're fighting. You're holding it there, and you go into what we call as the third response, called the freeze response. Now, all the traumatic experiences get frozen in your system. All those traumatic experiences get frozen in your system. And you are reacting from that experience of that frozen energy, even after years together. And the body reacts all the time as if it's happening now. When the chemicals are coming up, they are not getting used up, and like the water that gets stagnated, breeding germs and can cause diseases, same way, these chemicals, since they are stagnating, they, instead of supporting, they now become toxins. And that's how you start having a disease. And that is where the creation of disease happens. And let me tell you, you might think that, okay, but I haven't gone through a trauma. No, it's not necessary for you to know, because it could be very unconscious. It is very, very unconscious, because how would you know of something that has happened at the age of 6 months? How would you know of something that happened in the mother's womb? Like we know the story of Abhimanyu. Yeah, Arjuna and Abhimanyu. Arjuna is telling the story of how to get out of the Chakra War in the war to his wife, but the wife goes off to sleep halfway. Now he doesn't tell her how to come out. And now Abhimanyu, there's a war, that is Mahabharata, and Abhimanyu is out there getting into the Chakra War, but doesn't know how to get out and gets killed in the Chakra War. So we are all trapped in our Chakra War, and we are creating it. We are creating it, and thereby we develop diseases because we need it. And when we are working with this therapy, we are actually removing that need for that disease. That traumatic experience is released, healed, discharged, and now you can see things neutrally or healthily. And thus the nervous system gets back into a relaxed, calm mode. And thus the chemicals are whatever is required, that is only coming up. It's not overload. Thus the toxins are not forming. And now, since the body is not receiving those amount of chemicals or the toxins, it starts giving up the need to maintain that disease state, and thus the healing happens. And this happens not only when we are talking about diseases, it happens in relationships, also in other areas like business and all that. So thus, just going through this, you are able to treat various ailments. But of course, when we are talking about physical diseases, yes, anxiety, depression, migraines, headaches, peptic ulcer, Crohn's disease. I just had someone from US, a 12-year-old having Crohn's disease, and I was working with her, and she was suffering, and she was taking those medicines for a long time, I think maybe a year or two, and she was losing on her health. I think she lost some 12 or 20 kgs in few months, and we just needed one session. The child's anxiety, which was there, it has completely come down. She was so scared all the time, crying. The anxiety came down. She was able to think logically, normally. And in that 1.5 months, after which we had another session, she said, once I had this feeling of anxiety, but I could just sit there, observe what's happening, and boom, it was gone. So even a 12-year-old could get rid of it within a minute's time. So that is the kind of effectiveness. And one of the most important things is that this healing modality is like, I am placing the whole healing modality in your hands, even on the first day of the workshop, because it is so simple. But our human mind is such that anything that is simple, we don't receive it easily, because you're so used to look at things in a complicated manner. But it is very simple. And in the very first session, in the first day, you learn how to do it. And there are people who have been doing it for last 10 years, 12 years, and they practice it every day. In fact, it also becomes a very beautiful meditative practice, because that's the kind of effect it has on people, like deep calming experience. And once the nervous system calms down, it has no reason to hold on to the disease, and thus many diseases get healed. Right? Just see. So now trauma is a somatic experience, means at a body level. So remember, it has to be healed at the body level. But many times what we are doing, we have trauma at the somatic level. That's obvious. We are trying to treat it at the mind level, like change the thinking, change the memory, or ignore it, or not think of it, or just as if some light has come in and it has healed it. I've seen it doesn't work like that. It doesn't work like that. Because if it is somatic, like you have a dead rat in your house, suppose it's there in your kitchen. Now you can clean up all the bedrooms, you can clean up the washrooms, you can clean up the whole house. But till the time you don't go to the kitchen and remove the dead mouse and throw it out and clean up the whole place, the smell and the stink is going to remain. And that's exactly, if it is somatic, you got to deal with it at the somatic level. Any other way you do it, or any other place you do it, I'm quite sure you will not get the results. It is not possible. Yeah. So someone wrote, how to prevent ourselves from revisiting the event. You don't prevent yourself from revisiting the event. You get present to the event. That is what one of the ways to deal with this is becoming aware of it in a way that instead of working from the past, we are coming into the present, and core somatic integration becomes a very effective modality to remain in the present, what we call or what we hear or what we read about being in the present, being the present, being the present. Core somatic integration works at the present time level only. And that's one of the reasons it is so effective in its healing method, because it works in the here and now. So most of us have this tendency to say, oh, there's so much of it in the past and so deep rooted in me. There's nothing deep rooted, because if you open up your body, where do you see the experience? There's no experience. You cannot see it as like a liver or a spleen or a brain. You cannot see it like an organ. So deep rooted is what you feel because you are going through it so much. But once you connect to it and start healing it, it just starts releasing. And there's a particular way we call it as discharging the experience. Once that happens, automatically a lot of healing starts happening. And just going back into time where, like, I was, this is almost in 2001, 2001, everything was going on fine. And I had been a person who was suffering from irritable bowel syndrome. And I was told by the doctors that you'll never be able to heal yourself. You will have to live through this for the rest of your lifetime. And at that time, I was just a medical student. I didn't know what and how to go about with this. And I continued. And then 2000, 2001, there was a big change happening in my life. And in next 4 to 5 years, I went to severe amount of panic attacks, anxiety. I would wake up at nights having panic attacks, breathlessness, and all those things every night. And I would be crying because I didn't know how to heal it. And I was not taking any medicines or whatever. And then I went through this whole healing modality, but it was such a struggle, going through depression for a long time, having severe body pains, and of course, having this irritable bowel syndrome and severe pains in the abdomen, severe pains in the body, and not able to sleep, and a lot of problems in my sleep. I would not know what to do about it. And then came in core somatic integration. And now I can say that I have been able to heal so much so that I don't get any panic attacks. I don't have any breathlessness. My body is way, way fitter than many, many people who are way younger than me. Yeah. And also the thinking, I'm able to do my work better. I've been able to build up my profession in a way that, and in a very calm, relaxed way, I handle them. So that's a big change. My sleep is way better, and I remain joyful at most of the time. So this is how it is. Without any medication, how do you heal all these things? Yes, working with skin problems. We have had people with a lot of skin problems that has been dealt with. So these are just the names. Remember, when the source is dealt with, like when you remove the rat from the kitchen, the smell will not remain. Now, it doesn't matter whether the smell is coming in which part of the house, whether it's coming in the bedroom or in the living room, it doesn't matter. Same way, whether it's the skin or the liver or the brain. Like I've worked with people who have had pituitary gland ailments, yeah, and even high people with high girls with high prolactin. Lot of PCOD cases. Like I had someone who had a PCOD case. She came in with PCOD. She's a psychologist, and she came to me at the age of 20 or 21. Yeah, 21 maybe. And at that time, she said, I'm not interested in a relationship. I'm not interested in marriage. And I have this PCOD. And then going through that for the first 1 hour, she realized that there's so much of anger that she carried. And when I worked on the anger, she says, I just don't get along with my mother. And when we worked with that whole thing through core somatic integration, the next time when she came in after weeks, she said, Rajeev, I don't know, but I've been able to relate to my mother much better. I just feel so comfortable with her now. And after another 2 sessions, she came back and she says, Rajeev, I feel so comfortable with men now. And I think I may get into a relationship. The next time when she came in, she says, Rajeev, I'm getting engaged to a guy. I went for the marriage after 3 months. And today the PCOD was gone. And today she's a mother of 2, like a twins, 7-year-olds. So this is how it is. This was almost 8-10 years back. So, and this is just one of cases. I can There are so many cases of PCODs and migraines and severe pain disorder diseases that I have dealt with, and it's much easier to deal with it, and you know how to go about. And it's nice because you don't need to know a lot of things over here. You simply know one simple thing, that how the bodily experiences are being carried in the person, and then you deal with them. And the client is actually a partner in your healing, rather than you being a therapist who has to clear up the problem for the client. No, you don't do that. So the power struggle between the client and the therapist, that also vanishes. So this is also one session workshop which a lot of counselors and therapists and healers have done, and they have been using this in their practice, knowingly or unknowingly, because it becomes a part of your system. So this is some of the things that I would say. Yeah. Now remember, the natural state of body is health and wholeness. Symptoms are a way to warn you that you have strayed from the path of healthy living at some level, emotional, mental, physical, or spiritual. And it is indicating to return to the path of healthy balance. So somewhere we have moved away. And natural state is always health. Natural state is not disease. So many of us keep saying this, that, yeah, like I've grown old. Now this disease has to happen. The knee problems have to happen. The gallbladder has to get affected. Yes, at the age of 60, 65, after that you can get cancer, or you will get cancer. At the age of 40, you will get diabetes. No, that's all been filled up in your mind so that you fall sick. That's not the truth. You don't need to fall sick, because the natural state of body is always health and wholeness, and all the time the body is moving towards health and wholeness. But there's something that is there coming from the past which is not in sync with the natural state of health, and the body is only giving you a signal through symptoms. So don't see symptoms, pain as negative and try to suppress it. The more you try to suppress it, the more strongly the body will fight back and give you a disease, a bigger disease. So we have to understand this. And now core somatic integration therapy is a body-centered therapy where we are tapping into the innate healing potential by releasing the traumatic experience. Right? It is tapping into the innate healing potential by releasing the traumatic experience. And why is it so important? And this is what it is. We are moving from the Newtonian viewpoint of healing to Einsteinian viewpoint of healing. Right? From just looking at what could be causing it, like a cause and effect, we are going to the source of it. And there's a whole lot of questions that are being asked. There's a whole methodology to go about, which is being taught in these levels. And that is where the healing happens. And remember one thing, what I told you on the first thing, the first sentence, the body seldom lacks the ability to heal. The body is having the capacity to heal. What is lacking is our ability to interact with the body in a way to heal. We are not knowing that communication. We don't know how to interact with the body to heal. Though people keep saying, oh, change the food, change the diet. Yes, but I can guarantee you that's not the way of just healing. Yes, with natural diet, natural food, yes, it happens. But many of us have different ways of, or each one has their own way of saying, okay, this is good, have this, ye bhaji khao, and then have this food or have supplements. But why is it that we are still unwell and not able to heal ourselves? Because we got to learn the body's method of communication. And once we learn that, it becomes yours. Yeah. In this, we are also using neuroadaptability, neuroplasticity, understanding them. And then we train ourselves. We train ourselves just the way we learn driving, the way we learn any kind of sport. That's exactly how we are training ourselves. And once that is happening, automatically the body will stay healthy. This is what has been seen. We have spoken about all this. Remember, we are unconscious creators of disease. We start to heal when we make the unconscious conscious. I'll just share this with you. Like, there's this person who came to me, like it was in the workshop only. Yeah. Yeah, I talked to you about the PCOD. Endometriosis has been worked upon, and a person who came in the workshop, she was having severe. Can you hear my voice?
Yes, yes, yes.
Okay, Gupta, you'll have to figure out on your own side, yeah, what's not working. Nanda, can you hear my voice? Yeah, so everyone can hear. Nanda, you'll have to do something because Daman can hear. Preeta, can you hear? Show me a thumbs up. Yeah. Yeah. Okay, Anu. Yeah, thanks, Anu, for that. The people who can't hear me will have to figure out on your own side because rest of them can hear. Okay. So now, yeah, so there was this person who came to my workshop some 4 months back, and she was having this severe neck pain. And as I said, everything is like demonstrated when I'm actually teaching them how to do it. So a client is taken, or like whoever wants to go through the session can go through the session in the workshop itself. And then in next 15 minutes or 20 minutes, we worked upon the neck pain. And she connected to some old memory, and it was just like this open eye therapy. Yeah. And in next 20 minutes, she said the pain has gone away. I have been doing this, the yoga and physiotherapy and a lot of other things for last 2 years, 3 years, but it has never ever shifted. But in 20 minutes, it's gone. And today, I think it's almost 4 to 5 months, the pain has not come back. Another lady had severe pain at the elbow, severe. She kept writing to me that, Rajeev, it's very severe. You got to work on this. And I worked, and she was going through a very, very difficult part of her marriage at that time. And severe pain was there at the elbow, tennis elbow. And we started working, and it was just maybe 30 minutes. And she says the pain is down by 98%. It was down by 98%. And the next morning, when she came back to the workshop, the next morning, she said that, Rajeev, it's gone down 100%. So even after I spoke to her after maybe 2 months or something, she's saying, Rajeev, it is there around 60% is gone, 40% is there because she's going through a major problem in a marriage, like separation or divorce. So she says, I know why it is coming, and I'm going through so much of pain in my system. I just can't let go of that. So, but still, when we worked at it, it again went down, and that was again 1.5, 2 months back. So that is the kind of results we are looking at, and it is possible in many cases. It's very much possible that people start changing. Like I have had people who are taking doing substance abuse, and many youngsters at the age of 20, 25, and we have been able to I've been able to help them get out of that addiction problem. A lot of engineers, a lot of doctors, a lot of lawyers, severe addiction problem, have been able to help them get out of this addiction problem in just matter of few sessions. So these are the kind of changes that can happen when we are working at the source level. Yeah. So if there are any questions, please ask. After this, I'm going to share with you a small practice which you can use at your place on your own. Yes, so there are questions like, "70-year-old. Yes, if the person is willing and person understands, yes. No, it is not necessary that it will take longer. I cannot say because I have to see the client. Yes, in some people, yes, it does take a longer time because it is not just about the therapy. Remember, it is never just about the therapy. It's also about the therapist. Secondly, it's also about the client. There could be a resistance. There could be a deep layer of few layers that have to be dealt with. So that can happen. Yeah. So depending upon each one. Yeah. Okay. Let me. I have alopecia areata and thyroid since long. How to recover? See, one thing, Neelam, I cannot tell you how to recover. Yeah, because this is not, yes, I told you that there is a methodology that we go about, and that's how it is. Yeah. How to recover? Yes, you might need, because it's alopecia areata and the thyroid, then definitely the immune system is quite compromised in this case. So you might need therapy sessions. Yeah. Okay. Any other questions in whatever we spoke till now? Okay. So, yeah. So, how detailed info about how therapy and session will work? Okay. The process, I mean. So, great. So now the therapy always goes with a simple way, like any doctor does it or any therapist does it, by simply taking the case, understanding where the person is coming from, which is the sore point, which is the sore area of their, which has to be dealt with. So that is what we are looking at. And then once, and then we start dealing, and all that what is there is expressed in the body. Let me tell you, only thing we are not utilizing the body. The body is an instrument for us to know what's happening within, but we are not trained to connect to our bodies because of the way we have grown up. Whenever we have tried to connect to a body, like kind of, I felt sad or I felt angry and I felt something in my body or felt sad. So I was told that, okay, don't feel sad, don't feel angry. Why are you so scared? Are you a coward? So slowly the child learns to ignore those feelings. And the moment you ignore those feelings, they are there happening within you, but you don't pay attention to it. And many a times I've seen that even when they go to psychiatrists, many of them are busy labeling the disease or labeling, giving a label, that understanding where is it coming from. Of course, the time limit is so less for with them. And then they give the medicines. So that is not what is required. You got to understand where it is coming from and start healing them. And once you're able to do that, when you are able to do that, the disease will be healed. I have seen so many cases of anxiety and depression and severe amount of fears just vanishing. Okay, I have fibroids and doctor says my uterus is 5 to 7 years. Oh, that doesn't matter. That's not the problem. Yeah, even if you see, of course, age, I don't know how they calculate that, but then of course it can be healed, because anything, you can not only go back in your age with your organs, I can guarantee you, you can go back in your age in the way you look. So core somatic has a very unique anti-aging property. It has a very unique anti-aging property. Yeah, so it actually takes the whole organ, because it not only becomes a therapy, it also becomes a preventative. PCODs, yes. Prajakta, I cannot tell you what to do, very honestly, because I don't even know you. I'm telling you the way we go about. Yeah. But all these things need therapies. The PCODs, any kind of disease. Yes, we got to reconnect to the body and start healing them. That is what I can say. Because like I gave you the case of the PCOD or the PCOS case, that there was a lot of anger that was suppressed in her. And as we release that anger through the body centered method, we just took 1 or 2 sessions for the whole healing to happen. It doesn't have to be very drawn out and a long standing therapy. That is what I can tell you, Prajakta. Yeah, any other questions? Yeah, I get that. I get it. Yeah. So you can always try this. Prajakta, I get it. Though homeopathy is very, very good for such cases, I would not, I know that it works for it. Yeah. But I've seen with this therapy, it is way faster. Okay. Any other questions? Yes, it's the same thing. These are all names of the disease: acidity, PCOD, anything and everything. These are all names. Yeah, we don't go by the names. We go by what is actually happening. I'm suffering from severe anxiety since 4 years. I'm really tired of jumping from doctor. Just as you describe about your case, I cry every night. Really need help. Yes, then you need to take support. My whole body is swelling, a lot of pain. We can heal that. Yes. Can you please share the name of the doctor in the book? No, I don't remember. I read it a long time back. I don't remember the name. Brownstein, I know. I don't know exactly because when I was telling also, I just read it in one of the books. I just copied it down because it was so much of research that has been done on this. Hello, doctor, I'm suffering from severe depression, antidepressants. Okay, come on. You want to ask a question?
Yeah, yes, sir.
Please
So,
go ahead.
how to what is the major reason behind the Lincoln blindness? It's in the mouth, the sensitivity in the mouth.
I cannot say that what is the reason for lichen planus, but many a times it has been found that any kind of skin disease has to do with a lot of separation anxiety.
Okay.
You have to check
Okay.
whether the person has had some kind of separation anxiety, especially with the
Okay.
mother.
Yeah, you're right. It's me.
Yeah, so it makes sense.
Okay. Thank you.
Yes. So, Gaman, you have done the workshop, right?
Yes, I've done both. I've done both the levels.
Would you like to share something about the workshop for people to benefit?
Yes, yes, why not? So it's again, as you say, that you need to just connect to your own body. It's about the sensations going from one part to the another, and suddenly you just start feeling the emotions, what is connecting to, and then that is the part where you connect. Like now, I asked you
Yeah, yeah.
the
So,
key.
Gaman, what was your experience about the workshop and therapy?
So the experience is absolutely the same. What you're saying, it's like being in the meditative state, uh, uh, giving attention to the part which needs to heal. You need to give attention and go to the area which needs healing. It's like putting your attention there, and then from there it moves around, and you actually go into a meditative state, and you actually suddenly there's a boom, and you would come to know, okay, yeah, this is the reason, and then you need to heal that part of it with the XYZ person, or with yourself, or with the self suppression, as you're saying. And in my case, if you're saying with mother, it makes much more sense, because you know that the strain I have with her. So now it becomes little easier for me now to
What is the
uh,
change you found after you did the workshop?
what you said, that I'm living in more of an awareness of my body. I'm more aware of my body. So even if I'm walking and if there is a tilt in a knee, a little minor also, it's like comes to my notice very easily.
Great.
And then that is where I put my attention, and then
What is the
how you
change you found after that?
in my health, of course, overall, except for this thing which has come up new, this
Yeah,
thing, I was like in perfect health, really, really good
yeah.
health.
And health and relationships, what did you find?
Yes, both wonderful. Wonderful. And even the level 1, the level 2 is also more intense. And yes, and you being the teacher, you
Thank
know
you.
that.
And what do you do, Naman?
Yes,
What do you do professionally?
I'm a healer, therapist, and a
Good.
teacher by profession.
Great.
Yes, yes, but your own healing never stops.
Yes, great. Thank you.
Thank you.
Okay, so Nikita, you asked a question, will it be possible for everyone to regress? Yes, this is what has been seen. Yeah, because we are not trying to regress anyone. Remember, Nikita, it's all about being in the present. So it's not about regressing someone. Uh, yeah, so it's very much easy because the moment you connect, you start going back into the area that you got to touch upon. And that's where the healing happens. Okay, anyone else? Okay, thank you. So I just want to share this with you all. So I'll just share this with you all. I'm going to share with you one small case. Yeah. So people, there is this case of this person. Yeah. Can you all see this? Yes or no?
Yes.
Great. So this is a 20-year-old who had come down with. So 20-year-old who came with inability to walk because of some reason, and the doctors were saying you will have to take medicine for at least 3 months in order for the change to happen. So he was diagnosed as like it was the whole left leg had stopped working. It was like kind of paralyzed, and then he started at one point it was just not moving. It had become numb, and after some days he could just, but he was using a walking stick when he came to me. And this is the case of that person. And you will notice that this person, when he came to me, he's just able to lift his leg, the left leg. Yeah, I think the left leg for almost 3 inches. But the moment we did the therapy, after 20 minutes, he's able to lift the leg to almost more than 6 inches to 1 foot. And after that, he comes back again, only one session, comes back again after 5 days and after 20 days, and you will see the magic that is happening. So this is the boy. So if you notice his leg going up, I'm not, it's a very old case. So see, it's only 3 inches or something he can lift. Now you see how much effort he takes. See, this is the right one. Look at the left one. And look at the effort he puts. You will look at his face and his hands. See, now look at his face and hands. Look how tightly he's holding the handle and how much he's straining. And now look at immediately after therapy. This is, if you notice, this is 20 minutes after therapy. And you notice what will happen now. Look at his face again afterwards. See the way he lifts it. Almost a foot, and now look at his hand and look at his face. And this is just 20 minutes of one session of 20 minutes, and it's over. Much better. And now this is after 5 days. Look at him walking. That very day, he threw away his walking stick and he went out with his friends. I'll just take it ahead. See how he moves his leg. See, with a lot of ease. Now still something is remaining. That is what we could see. And this is the left now, going almost 1.5 feet. Means it's almost done, except that there's a slight. And now we'll do it after 20 days. You look at him. Now you look at him, how he walks. See now. It's completely fine. And is able to walk and move and everything. So this is the kind of change that happens. Yeah, thank you. Thank you, Naman. And this is just one-off cases, huh? I'm just talking about one-off cases because rest of the things cannot be seen on the screen because it's all internal. So all these things cannot be seen on the screen. Yeah, any questions anyone wants to ask, please go ahead, ask. We have next few minutes. Okay, just before that, let me also share.
I think I'll only tell everyone who's ready to join this. It's an experience totally. So they need to experience it actually.
Yeah. Thank you, Gaman. Thanks a lot. Anyone else who's there, who's been there? Because I've not called anyone from Yeah. Any questions, please ask. Otherwise, I'll just share the last part of this.
बैठना है ना
Okay. Now remember, the body heals itself. Yeah, what we need to learn is how to communicate to the body that it heals itself. That is what we need to learn. Yeah? And these are the steps to heal any disease. These are all the steps I learned on my own. Because I was going through this ailments, which I was suffering with, and step by step I was figuring out, I was naming them. And I found this method very effective, and I started teaching it to people almost 7 years back. And today almost 1,000 people have learned this therapy from me, so across the world. So this is and now the steps are acknowledge, tracking, witness sensing. That's a new word I've figured out for the whole session, what we do, how to support and move. And this is what we are learning, because we are holding it at that point when we are traumatized. We get traumatized because we have not been supported and we have not been able to move. That's the only reason we get traumatized. How do we support and move such that it heals, and then discharging and integrating that whole thing? So that is what we learn. And now Core Somatic is an integrative body-centered counseling and therapy, and we did this. Some of the diseases, like we were talking about, what kind of diseases can be healed: migraines, headaches, back pain, ankylosing spondylitis, arthritis, GERD, IBS, leukemia, cancers, menstrual problems, PCOS, endometriosis, behavioral problems, overcoming addictions, pain disorders, obesity, relationship conflicts, PTSDs, stress-related problems, depression, anxiety, OCDs, fears and phobias, trauma from death and loss, and many more diseases. Remember, action is the key. If you want to learn, you've got to take action. You can learn in 2 days the 6 steps on how to have freedom from diseases without any harmful side effects of medicines. Learn in 30 minutes steps to transform disease into natural health. In 3 hours, you learn this one methodology to have freedom from diseases without medicines, with no side effects. And this is just to be practiced. If you want to become more adept at it, you just need to practice it 5 minutes a day. If you want to become more and more aware of how, and this is very, very good for healers and therapists and counselors and psychologists. And they may not need to just practice for 4-5 minutes just to become more aware of how to do it. Yeah. And then I also have free talks or free webinars for people who have already graduated or done the first level. Even we have free sessions every month or maybe 15-20 days in which I take the doubt. So it is not the hand holding is there and then they learn. So that is how people are learning. Or how do you accelerate chaos? Like if you have, like I told you about the anxieties, which is going down in 2 sessions, 3 sessions, how do you make it very quick and develop personal mastery using self-awareness? Hundreds of counselors, therapists, doctors, psychologists across the world have integrated this modality into practice. And this is very true that many people have integrated this into their practice. They do it when they can't find any other method, they do it, or they have learned many other, like a lot of hypnotherapists, a lot of past life regression therapists, a lot of access bar people are using this modality along with the other modalities. A lot of doctors are using this along with this. There are a lot of dentists who have joined these workshops and these are dates are on 31st and 1st August. Yeah. So, and this is from 3 to 8 p.m. So just in case you are more interested, please write to me and I will share with you the details of the fees and everything. Great. Thank you. Thank you. Any other questions, friends, you want to ask? Please go ahead. My number is 9820800120. I'm just putting it down. 9820800120. That's my number. You can also visit www.rahjivnaidu.com. RAH. So this is there. I will also send to you some YouTube videos which you can look at. These are not really associated with the core somatic integration, but since you attended, I want to share this. At the same time, this is also about the moving stillness, which I teach, and people who are suffering from sleeplessness, anxiety and all can use these YouTube videos and send in a feedback as to how do you feel. Yeah, so you can just click on this or just copy it down and you can use it. Friends, any other questions you have? Yes, Yasmin, please ask, put on your video so that I can see you. Yasmin Walji, please open your video and talk to me. Hey, Soloni, thank you. Do you have any questions? Okay. How did you come across this healing technique? I didn't come across this. Like I told you, I was suffering quite a bit and I used to wake up every night. This was for 2 to 3 years. I woke up every night and I would, from 2:30 to 4:30, I would keep crying because there used to be so much of pain in my chest and I would not know why it is happening. And that is the time I would sit down and I would just notice what's happening and all that. And suddenly there was a point where I started healing myself. And that was the time I wrote down on the paper that if I can be with my body enough long time, it will heal. That was the first time. Are you going to share breakfast? I didn't get it.
How do we get the details of the program, sir?
Are you on the group?
No, I'm not on the group.
I will send it to you. You have my number. Can I send it to? Can you send me a message?
Yes, sir.
Okay. Otherwise, I can just send you right now. I will just show you. Okay. So what's your number, Preeta?
So 999.
Yeah. Just a minute. Yeah, 999.
53.
99953.
56.
56.
551.
551. You can, so this is, I'm just going to share this. Yeah, so this is the fees of the actual fees is rupees 14,000, which at currently till tomorrow it is at 7,000, 50% discount. And after that, it is going to be 9,500. Yeah, the date is wrong. And you can register by paying rupees 500 or in full. And the GPay or the Paytm number is 98208 00120. 98208 00120. 9820 800 120. So this is what is the thing. And I can guarantee you one thing, that for many people, this might look like, oh, it's a big amount. Let me tell you the amount you're suffering. If you actually put it down in daily loss that you're going through, that's in lakhs of not having your health properly, having breakdown in relationships, or the loss, physical, financial loss of going to doctors or doing the test again and again. It's in lakhs. So this is a very small amount that you'll be paying to learn and heal yourself. Yeah. Yeah, Radhika, if you are interested, please send me your number. I'll put it down, and or send me a WhatsApp on 98208 00120. Yeah. Shiranjita Sahu. Yeah, so I'm just going to share this. Yeah, I think you can see this. So it is 14,000, the fees for the workshop, and the early bird is 7,000 till tomorrow, 50% discount. And from after that, it is 9,500. That's on 30th, 31st. On okay. And the number, the GPay number is my phone number, WhatsApp number also, 98208 00120. 98208 00120. Yeah. So friends, who is interested, please contact and let me know. It's starting on Saturday and Sunday, 3 to 8 p.m. Okay. And anyone can join in, not necessarily therapists and all. Anyone. We have had a lot of lawyers joining in, and a lot of housewives, joining in. So anyone can join in. Okay. Any questions? Preeta, any question? Great, friends. So see you all. Nanda, any questions? No? Okay. Durga, bye. Subed, Anita, bye-bye. Yasmin, bye.
Thank you, sir.
Bye-bye.
Thank you for the lovely session.
Thank you.
Thank you, sir.
Thank you. Okay, friends, bye. Take care.